Hello, my name is Nancy Jacob. I'm a nurse practitioner student from United States University. I have to do a musculoskeletal exam for MSN 572. I have my volunteer here. I'm going to get his consent. But before that, I am going to sanitize my hands. And right now, just want to inform you that I am recording this video on the selfie mode of my phone. So I'm going to sanitize my hands now and get his consent. Hello.
Hi.
My name is Nancy. I'm a nurse practitioner student from United States University. I have to do a musculoskeletal exam. Do you consent to be examined, perform some tasks, record and upload the video on YouTube as enlisted for my professor to see and grade?
Yes.
Thank you. Do you have any concerns or questions before we proceed?
No.
Thank you. Can you give me your name and your birthday?
Melcher Jacob, December 8, 1967.
Thank you. So we're going to go ahead and start with the inspection. I'm going to go ahead and inspect your hands. Okay, so I'm checking for the symmetry of his hands. I am checking for any redness, any swelling, any deformities, any atrophy, any nodules. Okay, and so his hands look symmetrical, and I didn't see any of those that I mentioned. And then I am going to palpate the distal and proximal interphalangeals and the metacarpal phalangeals. So first, I'm gonna palpate the distal interphalangeal joints. So you're gonna tell me if you have any pain or tenderness, okay? So I'm gonna start with the distal ones. Distal VIP, do you have any pain?
No.
Okay, and then the proximal interphalangeal joints, do you have any pain?
No.
Okay, good. And then the metacarpal phalangeal joints, any pain?
No.
Okay, good. Okay, so now I'm gonna need you to do some range of motions. You're gonna make a fist. Okay, good. And then you're going to put your fingers down and up. You're gonna abduct your fingers and adduct your fingers. Okay, good. So now I'm going to inspect the wrists. So your wrists look symmetrical. I don't see any redness, any swelling. I don't see any nodules, any deformities, or any atrophy. Go ahead and turn them around. Okay, so again, there's no swelling, they look symmetrical, no deformity, no redness, no nodules. So I'm gonna go ahead and palpate the carpals. Any pain?
No pain.
Okay. Okay. And the metacarpals, do you have any pain?
No pain.
Okay. All right. Any pain there?
No pain.
Okay. Good. Any pain there?
No pain.
Okay. Good. So now I'm gonna do some range of motions on your wrist. I'm gonna go ahead and flex your wrist. Flex them down, good. And extend, good. Abduct your wrists, okay, and adduct your wrists. Okay, good. So now I'm gonna check for the specialty test to check for carpal tunnel syndrome. Check for the Tinel's test and the phalanx. So go ahead and then I'm gonna tap, open your, then I'm gonna tap on the median nerve. Any pain?
No pain.
Okay, and again, any pain?
No pain.
Okay, good. So I'm gonna do the phalanx test now. So you're gonna put your palms together like this, okay, and we're gonna keep them for about 30 to 60 seconds. And if you have any pain doing that, that means that you have carpal tunnel. Any pain right now?
No pain.
Okay. So, all right. So 60 seconds have passed. That's good. You can go ahead and put your arms down. Okay. So now I am going to check the elbows. Okay, so let me see your elbows. I'm inspecting the elbows for symmetry, deformity, swelling, redness, nodules, I don't see any. And then I'm going to palpate for the external surface of the ulna. Do you have any pain?
No pain.
Okay. And then the olecranon process. Have any pain?
No pain.
Okay, good. And then I am going to palpate the medial epicondyle. Do you have any pain?
No pain.
Okay, good. If there's any pain on the medial epicondyle, it means that the patient has golfer's elbow or baseball elbow. And now I'm gonna palpate the lateral epicondyle. Any pain?
No pain.
So if there's any pain in there, that means that the patient has a tennis elbow. Okay, that's good. So now I'm gonna need you to do some range of motion. So you're going to flex your elbows, good, and extend your elbows, good, and going to pronate your elbows, good, and supinate, good. All right, did you have any pain with those?
No pain.
Okay, that's good. So now we're gonna go ahead and proceed with your shoulders. Go ahead and move a little bit forward towards the edge, so I can check your shoulders. Thank you. So I'm checking the shoulders, the anterior and the posterior. Okay. So, right. So I don't see any asymmetry. They look symmetrical. I don't see any redness, no swelling, no deformity, no atrophy. Okay, and there's no nodules. Okay. So now I am going to palpate the shoulders, starting with the AC joints, the acromioclavicular joints. Any pain with that?
No.
Okay. And then the coracoid process, any pain?
No pain.
Okay, good. And then the tubercle of humerus, do you have any pain?
No pain.
Okay, and then the biceps groove, any pain?
No pain.
Good. And then the subdeltoid bursa, any pain?
No pain.
Okay, good. So now we're going to go ahead and stand up for me, thank you. And we're gonna do some range of motions on your shoulders. I'm gonna raise this. Okay, so we're gonna do flexion of your shoulders. Flex forward. Okay, good. Any pain with that?
No pain.
Gonna extend. Good. I'm gonna duck. Good. And adduct. Arms over. Good. And we're gonna do internal rotation of your shoulders with your arms on your back. Good. External rotation with your arms on your. Good. All right. That is good. Okay, so now we're going to do the special test to check for rotator cuff tear, for possible rotator cuff tear. So the test is called an empty can test. So you're gonna raise your arms and pretend like you are emptying a can. Okay, good. Now I'm going to press down. Did you have any pain?
No pain.
Okay, good. All right, so the empty can test is negative. Okay, so you can go ahead and have a seat. We're gonna check your head and neck. Okay, so I'm checking the neck right now, and I'm seeing that there's no redness, there's no swelling, there's no nodules. The neck, there's no deviation in the neck. Each side looks symmetrical. And now I'm going to check for TMJ tenderness or temporomandibular joint tenderness. Okay, so I'm gonna need you to, if you don't mind, do you mind removing your mask? Okay, good. And then I'm gonna palpate your TMJ, your jaw. So you're gonna go ahead and open your mouth and close your mouth. Open, close. Did you have any pain with that?
No pain.
Okay, good. All right. So go ahead and open your mouth and move your jaw side to side. Good. Any pain with that?
No pain.
Okay, good. So now I'm gonna check the degree of opening of your jaw. If you can just, you don't have to put your fingers inside your mouth, so just kind of do 3 fingers. Okay, good. All right, so he's able to open his mouth and his jaw with no difficulty or pain. Okay, that's good. Go ahead and you can put your mask back on. Okay, so now I am going to palpate the sternoclavicular muscle and joints. Do you have any pain?
No pain.
Okay, good. Okay, and then I'm going to palpate the paracervical muscles. Do you have any pain?
No pain.
The cervical spine, any pain?
No pain.
Okay, good. And then trapezius muscles, any pain?
No pain.
And then the rhomboids muscle, any pain?
No pain.
Okay, good. So now we're gonna do range of motions on your neck. Gonna do flexion first. You're gonna touch your chin on your chest. Good. Any pain with that? Okay, and then you're gonna hyperextend your neck, look towards the ceiling. Any pain?
No pain.
Okay. You're gonna rotate your neck to the right. Good. And to the left. Good. And do lateral rotation. Good. Good. Right. Did you have any pain with that?
No pain.
Okay. So the special test that I'm gonna do on the neck right now is called the Sperling test, also called the cervical compression test, to check for cervical radiculopathy, and this should not be done among the individuals with cervical injury or spinal injury, and also for cannot be done with individuals of advanced age. So, but since he meets the criteria, he's at an elderly and has no cervical injury, we're gonna go ahead and perform the Sperling test. So I'm gonna go behind him, and how it's done is I'm gonna have you tilt your head just a little bit to the side, okay, and then look up a little bit to the ceiling, okay, and then I am going to apply pressure downwards on his head, and if he complains of pain, then that means he has a cervical injury. So I'm gonna compress. Do you have any pain?
No pain.
Okay, good. Okay, so now I am going to check your feet and your toes. So go ahead and sit back, and I am going to raise the foot of the recliner. Okay, you comfortable? Okay, and then I'm gonna adjust the camera to show the feet. Okay, good. So I'm gonna check your feet, inspecting the feet for any corns, any callus, warts, bunions, any deformities, inspecting for any swelling, any redness, and they look symmetrical. Okay, so now I'm going to palpate the distal and the proximal interphalangeal joints. Okay, so you're gonna tell me if you have any pain. I'm gonna palpate the distal interphalangeal joints now. Okay, any pain?
No pain.
Any pain here?
No pain.
Okay, good. And then I'm gonna palpate the proximal interphalangeal joints. Any pain?
No pain.
Okay. Any pain?
No pain.
Okay, good. Okay, and then now I'm checking, palpating for the metatarsals. Any pain?
No pain.
Okay, good. Okay, and now I'm gonna I'm going to check for Morton's neuroma, palpating for Morton's neuroma. Do you have any pain there?
No pain.
Okay, good. And then the other side, do you have any pain there?
No pain.
Okay, good. And then I'm gonna check for plantar fasciitis. Do you have any pain?
No pain.
Okay. And any pain there?
No pain.
Okay, good. Any pain? All right, good. And also, I am checking for plus planus or flat feet, and the ideal way to inspect for flat feet is with the patient standing. But because I can already see that he has good arch on his feet, and see, I can see the arch right here. That means that he has no flat feet. He has no pes planus. Okay, that's good. So now we're going to be doing range of motions on your toes. So go ahead and flex your toes down. Good. And extend up. Good. And then you're gonna invert your feet in. Good. And inversion out. Good. Did you have anything with those?
No.
Okay, good. So now I am going to check the ankles. Then lower that down. Okay, let's check the ankles. Okay, so I'm checking the ankles for symmetry. They look symmetrical. There's no redness, swelling, no discoloration as well. I don't see any nodules. So I'm gonna palpate the medial malleolus. Any pain?
No pain.
Lateral malleolus. Any pain?
No pain.
I'm gonna palpate the Achilles tendon. Any pain?
No pain.
Okay, and then the Achilles tendon. Do you have any pain?
No pain.
Okay, good. So now I'm gonna be doing passive and active range of motion. I'm gonna do the passive range of motion first, and then when I'm done, you're gonna do it yourself. Okay?
Okay.
So I am going to dorsiflex your ankles, and then flex your ankles, and then rotate. Okay, did you have any pain with that?
No pain.
Okay, dorsiflex, flex, and rotate. Any pain with that?
No pain.
Okay, good. So now you're, can you do it yourself? Dorsiflex, flex, and rotate. Good. Okay. So now I am gonna check your knees. Okay, I am inspecting the knees for symmetry, for any redness, any swelling, for any deformity, any nodules, which I don't see. And I'm gonna palpate now the suprapatellar pouch. Any pain?
No pain.
Okay, and I don't feel any swelling or anything that could be an indication of any liquid in there, fluid. Okay, and then I'm palpating the size of the patella. Any pain?
No pain.
Tenderness? Good. Okay, now I need you to bend your knees so I could palpate the popliteal fossa for Baker's cyst. Okay. I don't feel any Baker's cyst. That's good. Okay, I don't feel any Baker's cyst. That is good. Okay, so now I am going to be doing some passive and active range of motions on the knees. So first I am going to extend the knee. Okay, good. Any pain with that?
No pain.
Okay, and then flex the knee. Any pain?
No pain.
Okay, extend the knee. Any pain?
No pain.
Good. And flex the knee. Any pain?
No pain.
Okay, then if you can do it yourself, good. Extend, flex, good. Extend and flex. Okay, that's good. So also, as I can see that I don't see any bow legs or any knock knees right now. There's no valgus or varus deformities on his knees. So his knees look good. So now I'm going to be doing some special tests on the knees. I'm going to be doing the valgus test, the varus test, the Lachman test, the drawer test, and the McMurray's test. These tests check for injury, possible injury on the medial and lateral ligaments of the knees or the meniscal injury or anterior and posterior cruciate ligaments of the knee. So I'm gonna go ahead and do the valgus test. Okay, so I'm gonna need you to extend your legs. Okay, so to do the valgus test, I am going to with my let's see, with my hand on the lateral side of the knee and my other hand on the tibia, I am going to abduct the knee. Okay, any pain?
No
With
pain.
that? Okay, good. So that is the valgus test. And then I'm gonna do it on the other side as well. Okay, and I'm gonna do the valgus test. Any pain?
No pain.
Okay, good. Okay, and now I'm going to do the varus test. So I'm gonna put my hand on the medial knee, and then I'm gonna adduct the tibia. Any pain?
No pain.
Okay, so this is varus test, and I'm gonna be doing the same thing. The medial knee and the tibia gonna adduct. Any pain?
No pain.
Okay, so that is the varus test. So now I am going to do the Lachman test. Okay, so I'm gonna need you to bend your knee about 20 degrees. So I am going to put my hand behind the lower part of the femur and then push down on the tibia. Okay, so I am pulling up and pushing down. Any pain?
No.
Okay, and then the other side. Okay, have any pain? Okay,
No pain.
any pain? Okay, good. So the Lachman test is negative. So now I'm gonna be doing the drawer test. So I'm gonna need you to bend your knees. Bend your knees. So ideally, I should be sitting on his foot. Okay. So I am going to do the anterior drawer test. I am going to push on the tibia like this. Push forward. Do you have any pain?
No pain.
Okay. Any pain?
No pain.
Okay, good. Right, and then the posterior drawer, any pain?
No pain.
Okay, any pain?
No pain.
Good. So, next I'm gonna do the McMurray test to check for meniscal injury. So, I am going to straighten your leg, okay? And then I am going to medially rotate the tibia. Okay, medially rotate the tibia. Right, and then, yeah. Okay, and then bend and medially rotate the tibia and then extend. Okay, good. Did you have any pain?
No pain.
Okay, and then again I'm going to bend the knee, medially rotate the tibia and then extend. Do you have any pain?
No pain.
Okay, good. Excuse me, let me just blow my nose. Sorry. Okay, I'm gonna sanitize my hands. Okay, so the specialty tests are all negative. The patient did not have any pain or tenderness. Okay, so now we're gonna proceed with inspection of the hips. So I am going to have you stand up if you don't mind. I am going to lower the foot of the recliner. Okay, so alright. So I'm gonna check the hips. Go ahead, if you don't mind standing up. Okay, and then kind of turn around. Okay, so I'm can I lift up your shirt? Okay, so I'm checking the hips for symmetry and alignment to make sure that one hip is not higher or lower than the other. Okay, and it looks good. Looks symmetrical. I don't see any swelling, no redness. Don't see any nodules. Okay, so now I am going to palpate the anterior superior iliac spine. Okay, any pain? Even pain?
No.
Okay, and then the posterior superior iliac spine, any pain?
No.
Okay, and then the greater trochanter, any pain?
No.
Okay, and then the sacroiliac joint, do you
No.
have any pain? Okay, good. All right, so now I'm gonna need you to do some range of motion. Okay, so you can go ahead and turn around. So we're gonna be doing some range of motions. I'm gonna be doing some passive range of motions first, and then you're gonna do those motions by yourself after I do it, okay?
Okay.
So we're going to let's see. So I think we're gonna go ahead and have you lay down if you don't mind. So with your head in there, good. Okay. So okay. So I am going to do the range of motions on your hips. Okay, so you're going to do flexion. Okay, so flexion. Any pain?
No pain.
Okay, good. Any pain?
No pain.
Good. Okay, and then I'm going to do extension. Okay, extension. Okay, any pain?
No pain.
Any pain?
No pain.
Okay, so we're going to do internal rotation now and external rotation. Okay, so I'm gonna flex the knee 45 degrees, and then that's external rotation. Any pain with that?
No pain.
Okay, and then internal rotation. Any pain with that?
No pain.
Okay, good. And then the other knee. Any pain with that?
No pain.
Okay. Internal rotation. Any pain
No
with
pain.
that? Okay, good. So now we're gonna do the hip abduction. So anything with that?
No pain.
Okay. And adduction. Anything with that?
No pain.
Okay. So on the left side, anything with that?
No pain.
Any pain?
No
Okay.
pain.
So now you're gonna be able to do those range of motions by yourself. Okay, so go ahead and flex your knee up to your chest, on your abdomen, good. Alright, go ahead and put down. Okay, and then the other, good. Okay, and then you're gonna go ahead and extend your hip, good. Good. Okay, good. And then do external rotation. Bend your knee and out that way. Good. And then internal rotation. Good. Okay. Good. Good job. Internal rotation. Okay, and then abduct. Okay, good. And adduct. Good. Okay, good. And abduct. Okay, good. So that's good. So patient was able to perform the range of motions on his hips. So now I'm going to be doing some special tests on the hips called Thomas test and the Patrick test, or the Faber or FABER, flexion, abduction, extension, external rotation. This checks for hip contracture. So I'm gonna do the Thomas test first. So I'm gonna have you bend your knee, this knee, and then pull it towards your abdomen. Go ahead and put this. Pull it towards your abdomen. Okay, good. So what I'm really observing is the other leg, and the leg is flat on the couch. So that means that the test is negative and he has no hip contracture. That's good. Okay, you can go ahead and put your leg down. Okay, and now I am going to do the Patrick and the Faber or FABER test. So I am going to have you bend your knee, okay, and put it on top of your femur right there, and then I'm gonna press down gently and firmly. Check for, do you have any pain?
No pain.
Okay, like that. Okay, and then go ahead and do the other side. Okay, good. Then I'm gonna press down firmly and gently. Did you have any pain?
No pain.
Okay, good. So the specialty tests, the Thomas and the Faber test, are negative. Okay, so the last test we're gonna do is to check your spine. Okay, so since the patient is already laying down, I'm gonna go ahead and just do this straight leg raise. Okay, and this checks for spine problem and radiculopathy on the foot and the toes. So I'm gonna go ahead and do that straight leg raise. Okay, do you have any pain?
No pain.
Okay, good. Do you have any pain?
No pain.
Okay, good. All right. So the straight leg raise is negative. Okay, so for me to check your spine, if you don't mind, I'm gonna need you to stand up. Need any help? Okay. Good. Alright, so position the camera. Okay. Good. So to check his spine, I'm checking for the symmetry of the shoulders, the symmetry of the hips, to make sure that one shoulder is not higher than the other, and then one hip is not higher than the other. Then I'm checking if patient has any lordosis or kyphosis, okay, which I don't see any. Okay, and then I am gonna need you to, so when you bend forward, I'm gonna be checking your spine to see if you have any scoliosis, to see if one scapula is higher than the other and one hip is higher than the other. Okay, so I'm also gonna see the smoothness of your spine. Okay, so go ahead and bend down as far as you can. Okay, let your hands up like this. Okay, good. So the scapula are symmetrical, they're the same height, and then the hip are the same height. I don't see any scoliosis. His spine looks straight. Okay, and the normal flexion is 90 degrees. Okay, so that's good. All right, so go ahead and stand up. Good. All right, so now I'm going to check the smoothness of the spine. Okay, palpate the spine. Okay, and feel smooth. Okay, and now I am going to percuss the spine to see if there's any pain or tenderness using the ulnar surface of my fist. Any pain?
No pain.
Okay. Pain?
No pain.
Pain? Any pain?
No pain.
Okay. Okay. Good. All right. That is good. And go ahead and turn around. Okay. So Now I am going to do some range of motions on your spine. So you're going to, since you already did the flexion, I'm going to have you do extension. Go ahead and go like this. Good. Did you have any pain with that?
No pain.
Okay, good. So I'm going to need you to bend on your waist. Good. Bend. Okay, good. Any pain?
No pain.
Okay. Then you're going to do twist. Okay, good. Did you have any pain with that?
No pain.
Okay, well that is good. All right, so that is the conclusion of our musculoskeletal exam. You can go ahead and have a seat. Okay, so everything looks good. Did you have any questions or any concerns?
No.
Okay, good. I appreciate your cooperation. Thank you.
Thank you.
All right, thank you.